I'm Craig Mcmillan from Surescreen Diagnostics, and this is Mark Dunning from TestCard. The thank you is for making it to the final session. At least we know you're committed, so we know you're interested. Now, our title is The Future of Diagnostic Testing is Digital. To be a little more focused, we're actually talking about rapid point-of-care testing. And to be very specific, we're talking about lateral flow testing, which by the end of this presentation, we want to have proven to you that the humble lateral flow test, which we've all used in the past, combined with the right digital solution, can be used in the future to really support care pathways and speed up time to treatment. Now, our two companies, Surescreen Diagnostics, we make lateral flow tests, and the first few slides will just be me revisiting that. And then Mark will take you through a case study about where we really brought this to life and where it really benefited St Thomas's Hospital. Now, the history of Surescreen Diagnostics is we used lateral flow tests 30 years ago, not myself, but we had products for testing drug and alcohol. So we would be a business-to-business company going in and looking at testing employees to see if they'd been abusing cocaine, heroin, opiates, testing urine, testing oral fluid. And then they gradually evolved into healthcare products. Our biggest seller to the NHS would have been a pregnancy test lateral flow. And then COVID hit. And at the time of COVID, the government was very much focused on we need to protect UK supply. We'll all remember the Dyson stories. They were going to build all the respirators. I don't remember people talking about the food pumps that every respirator would need, but it was all over the news that the UK supply. Now, Surescreen Diagnostics, they had this lateral flow expertise, so they started to research, could we get a COVID, first of all, antibody test and then antigen test. And then the 7 tests that you would get through the poster from the pharmacy, in the end it ended up they were either imported or they were Surescreen Diagnostics. They were the only UK manufacturer that won that government contract. So after COVID, though it hasn't gone away, we started looking at the lateral flow tests beyond COVID in the healthcare environment, creating D-dimer, creating CRP, RSV, flu, AB, a combination test where one sample you could test for COVID and you could test for flu and flu A and flu B at the same time. So the quick science bit is looking at how a lateral flow test works, because, as I say, they're brilliantly simple to use. I guess the vast majority of people used COVID tests during COVID, the pandemic. But there's actually quite a bit of science goes into them, even though they're so simple. And our head of R&D, I always assumed would be a chemist, who's actually a physicist, because it's all about molecular movement and interactions. So it is quite complex science, but very simple to use. And it's all based on gold particles. And what will happen is the gold particle is used because it's inert, and gold particles are bright red. They look like wine in the photo. That's liquid gold particles. And that's your line you see in your lateral flow test. And then what they'll have attached to them is an antibody. And that antibody is specific for what you're trying to detect. And another part that's important is the membrane that these gold particles will run along. So the quality of the membrane can make a difference to the quality of the test. And that's what's important, because what we found post-COVID when we spoke to point-of-care practitioners and we spoke to the NHS was people almost wanted to move away from lateral flow tests. And when we asked why, they talked about there was a lack of innovation. They spoke about how they weren't as accurate as labs. And they spoke about how there's no governance behind them and no traceability behind doing the tests. So I'm hopefully going to quickly cover off the first 2 points, and then Mark will talk about point 3. So the innovation, there's innovation in the membrane, there's innovation in the quality of the gold particle, there's innovation in finding the right antibody. And then what happens is you take a sample for whatever you're testing, and it goes into the sample pad. It then goes along and picks up all these gold particles. And what will happen is if it's positive, and I'm hoping this slide is here, yeah, the next slide's probably better, it'll pick up the analyte for what you're looking for, which will match the antibody receptor. So they will combine, and if they combine, on your membrane, you have another capture antibody. And that's your line. It's basically what you're looking for has combined your gold particle to a test line, and then that comes up as a solid line. So when you have abundant antibodies for COVID, for RSV, these gold particles attach to it, and then they attach there. There are other lateral flow tests where the reverse is true, where the antibody blocks the receptor, and therefore no line is a positive. But we probably should have hidden that slide because it's not relevant to healthcare. That's more than your drug and alcohol screening. But ultimately where we get to is the innovation. To that first point, there's no innovation. There's a lot of research can go into what antibodies you're using for the different antibodies. And an example of that is people last year may remember there was a media frenzy around strep A. And it was built on, unfortunately, children, teenagers were dying, and the media had picked up on this. I think a government MP at the time said we should give every child at school antibiotics just in case, which was a soundbite in the media, which is obviously madness. So in that time, Surescreen Diagnostic looked at strep A, and within 6 weeks had sent a product to Portland Down that the government approved. Now, at that stage, the frenzy had died down, but now we have a strep A test that we talk to pharmacists about, and we talk to hospitals about, we talk to paediatricians about, that could help them making the decisions. It's not definitive about it's, and I'll come on to how accurate they are. No, it's not a lab test. It's not got the same sensitivity or specificity as a lab test, but it can help you make an informed decision while you're waiting for a lab test to come back. We can do multiple tests on multiple strips. We don't have to look at natural antibodies. We're looking at synthetic antibodies. And we can use these tests to test saliva, oral fluid. Nasal swabs is what we've been talking about today, because it's all about respiratory diseases, strep A, RSV, flu. So the first piece we'd heard was they're not innovative. They are. It's just they've been about for so long, we've not realised that they do a very good job. It's just about what you set them up to look for. And then when it comes to are they as strong as, are they as sensitive as labs, have they got the same specificity as labs? The answer is going to be no, because effectively the limit of detection for a PCR, it needs 1 to 100 copies per mil of your target antibody, whereas the lateral flow test will need more. But if you think of sensitivity as your number of false negatives and your specificity is your likelihood of false positives, when we look at that and we look at what our figures are, 100 being perfect, for COVID, it is 99% specificity and 96% sensitivity. And then we look at pregnancy, 99.9% on both. We look at RSV, 99.1, 98.5. Strep A, 98.1, 95, all in the mid to high 90s. And that's the point. I used to work in pharmaceuticals. Mid to high 90s is a pretty good score in a clinical study. Is it as strong as lab? No. With scores like that, could it have a place in patient pathways? Could it have a place in decision making? Yes, without doubt. So the first two, is it innovative? Is it as strong as labs? Actually, lateral flow tests are very innovative. They're very sensitive. They're very specificity, and you can see I keep struggling with that word and always have. And then that last piece, governance, I'm going to pass over to Mark, because he's got, I said case study, real world case study. It's more like he's got a real world success story where this has been put into use within the NHS.
Thanks, Craig. So we'll go through this today, and I think that there's lots of slides that we can skip through. But essentially, what I wanted to talk you through today is the partnership between TestCard, Surescreen Digital, and Guy's and St Thomas NHS Foundation Trust. And there's a case study, there's a QR code coming up which we can scan. But as Craig said, this is a real-world success story. Now, essentially, we've been working in partnership with Guy's and St Thomas NHS Foundation Trust for over 3 years now. We've provided over 425,000 lateral flow tests, and I'll come into the case study in a moment. But essentially, the Surescreen reader is used to support users to perform the test correctly. We use computer vision analysis for suggested reading, and I'll show you how that works. And we provide instant recording of the test results, so we can read qualitative, semi-quantitative, and now fully quantitative test results. And I'll come on to some work a little bit later we're doing with UKHSA and Guy's and St Thomas NHS Foundation Trust, where we're using the Surescreen dual COVID flu test to be able to look at the density of the line and show a CT value and ultimately viral load. And we're looking at outbreaks in the care homes. So there's a study that will be produced a bit later this year, and then we'll carry on that study this winter. And the key benefit of our digital reader, and I'll take you through how it works, is we integrate these results into Epic, so that there's a clear record of that test result in the electronic patient record. But this was the problem during the pandemic. So Surescreen was created in partnership with Guy's and St Thomas NHS Foundation Trusts. Lateral flow tests were used in many areas already, but as a workaround, they were using the Nova glucometer to try and read the tests and manually updating records. So we saw huge manual errors. So we partnered with Guy's and St Thomas to deploy the solution that's performed to a consistent high standard. We meet all of the legal requirements, we provide good governance, and essentially this is a system that was designed by healthcare professionals for healthcare professionals. And then a report that came out following the pandemic, and UKHSA recommends, and this part at the bottom here, that lateral flow digital reader outperforms human readers in the accurate interpretation of lateral flow tests. It's got high usability, and most importantly for the NHS, it provides a net cost benefit to the use of lateral flow tests in community testing. So it saves money in the short, medium and long term. And now we've rolled out further than just Guy's and St Thomas, and we're rolling out across the NHS in a number of settings. So how is Surescreen supporting the NHS? We've got a little bit of an editing issue there. But essentially, working with Surescreen, we add some additional markers to the lateral flow test. So we have a QR code, so we know that the test is unique. It's the test we think it is. It's got a confirmed test type, and we have a lot number and expiry date, so we can't use the test if it's expired. And we provide the integration into a portal and into the electronic patient record, so we see less errors and instant visibility of these test results in the web portal. So this is the process flow. So patient enters the hospital at Guy's and St Thomas. They're provided with a COVID flu lateral flow test available within 10 minutes, which allows the patient to be cohorted immediately, which reduces the number of side room usage, improving patient safety. Results are available in electronic patient record, and in the business case, we outline the full cost-benefit analysis that we've provided through this. All of our technology is integrated into all electronic patient record systems via all the middlewares that are out there at the moment, and we can save up to £16 per test. And there's some more information that we can send you around the pathway at Guy's and St Thomas, because as Craig said, there is absolutely still the need for PCR testing, but the process flow, the patient pathway at Guy's and St Thomas, is they'll come into A&E, they'll have a rapid diagnostic test. If they're positive, they're positive. If they're negative, then they'll still go for a PCR test from that sort of thing. So it absolutely has its usage in cost saving. This is an overall of the technical system, which I will quickly show you through. So we have positive patient ID, we scan the test request ID as well as the patient ID. And then we have a range of tests that are available in Guy's and St Thomas. So pregnancy, dual COVID flu, single COVID, strep A, RSV, as Craig mentioned. We support the user throughout scanning the test, and then the user is provided with a result that goes into electronic patient record. You have to give me a steer on time, sorry if we're going over.
No, fine.
And this is just an example of the portal. So what we do is using our image analysis, we scan the lateral flow test, and then we provide the user with a density plot, so between the control line and the test line. And we also, it's not just lateral flow tests, but we can also read urine dip tests as well, which has a lot more clinical utility in primary care. How many of these test results actually end up in the patient record in GP surgery? Very few, because they're put up against the the tub itself. So we can read all 10 parameters, and then we put the results into the electronic patient record. We integrate into both primary and secondary care systems. And this is one of my last slides, so I just wanted to kind of show you some of the issues that we've seen at Guy's and St Thomas, and we picked up with our system. And we didn't allow these results to go through. So our system, when we have issues such as these, we alert to the senior resources within Guy's and St Thomas to then go back and provide additional training to the user on the ground. This test is not leaving the test long enough, so it's a false negative risk here that we picked up. This is where the test's been left too long, so the lane's dried out, false positive risk. Sample buffer loaded into the lane instead of the well, which we've seen. And this for, as Craig said, for a COVID flu nasal swab is what we call a WTF issue, where we've had blood loaded into the sample well. So there's just some examples of things that we're picking up with the users and reporting to allow additional training moving forward. And then this is what it looks like in the portal. So we've got full traceability of where the test was taken, when it was performed, who it was performed upon, and all of this information goes into the electronic patient record. And this is the case study that we can send to you. There's actually a QR code there, which is the impact of the solution at Guy's and St Thomas. So we did see a reduction in PCR tests because of the introduction of lateral flow tests, as well as repeat testing upon admission. I'll skip through these. We have a managed service contract which is in place with Guy's and St Thomas, and we're also listed on a number of frameworks, but happy to take any questions around the digital reader or around the test itself.